This is a video abstract for the manuscript shown here. In the study, we use a Bayesian time-to-event model to further investigate the association between the diabetes drug SGLT2 versus DPP4 and cardiovascular outcomes among veterans with diabetes. The motivation for using a Bayesian approach is that previous studies have found varying effect estimates for SGLT2. If you look at the table in the right column, you see you've got the estimated hazard ratio and 95% confidence intervals. A hazard ratio of 1 suggests no association, less than 1 a protective association, greater than 1 a harmful association. We can see that the hazard ratios change by cohorts and also the cardiovascular outcomes of the composite versus just heart failure or hospitalization. You can see that some of the effect estimates are statistically significant and protective, others are not. So based on this, you can see that it's difficult to make conclusions about a protective association between SGLT2 and cardiovascular outcomes based solely on these statistics. So we decided to investigate this further using a Bayesian time-to-event model that not only provides us with hazard ratios and 95% credible intervals, but also allows us to make probability statements. We looked at the probability of a meaningful effect, which you defined a meaningful effect as a hazard ratio less than 0.9, and that was the cutoff of 0.9 was based on previous studies. You can see that we have a 93% probability of a meaningful protective association for the composite outcome, and then high probabilities for the components except for CVD hospitalization. In addition to making probability statements, we can also incorporate skepticism or favorability for a protective association using informative priors on the coefficient of the SGLT2 effect. And we see the results for different Bayesian models here. We have a prior that's skeptical of a protective association based on cohorts with patients with no history of CVD. We've got a prior where it's favorable, looked on cohorts at patients with a history of CVD, and then a neutral uninformative prior all suggest a protective association and a high probability of a meaningful effect. So this Bayesian approach is a nice addition because it allowed for the calculation of the probability of a meaningful protective association. It also allowed us to incorporate skepticism or favorability for clinically meaningful effects. The Bayesian models provide strong support for a protective association between SGLT2 and the composite outcome. However, the protective association was not as strongly supportive for the individual component CVD hospitalization. Thank you.